Hi everyone, Dr. Paul from Hair Transplants Melbourne. This is a patient who has come into the clinic. Very happy for us to film part of the consultation here. I just wanted to show what a very typical horseshoe deformity looks like in a male client, where we're losing these apexes. The whole hairline here has been lost all the way back into the mid-scalp, and then it forms this horseshoe all the way around to the other side where we've repeated the apex similarly to what's happened on the other side. It's important to point out the importance of this kind of central forelock of hair here. It really, if this is maintained strongly, and in a lot of male patients it tends to be, it's quite anti-aging, and it can mean that patients like this can really carry off quite a significant amount of hair loss and still look quite youthful when they've got this strong forelock of hairs. In this type of patient too, because this is what we call male pattern baldness, or mostly related to dihydrotestosterone or DHT levels, we've also got a little bit of crown thinning at the back here. How I would treat this kind of hair loss, look, the crown, I often like to see if someone hasn't given a good dose of medication, a good dose of side effect free medication, we can always try to find a dose that's appropriate for somebody that doesn't give them the side effects but has the positive effects on their hair. I like to try that, plus some in-clinic treatments such as PRP and exosomes or a Regenera stem cell treatments, in order to try and densify up this crown area. And then once we've gone all the way with that, sometimes a bit of scalp micropigment at the crown can be really beneficial. Scalp micropigment, there's good and bad scalp micropigment. So when it's done well, it really makes the crown pop. And it means that we can concentrate most of a hair transplant at the front, because this type of hair loss is hair transplant territory. Regenerating a hairline here in virtually nude skin, there's hardly any hair there, is what I would call the definition of a fool's errand. It just doesn't work. This is transplant territory, and I would extend some of the transplant back here. Again, the mid-scalp can respond to medication, but given that we've got this whole area here, I think a transplant treating this whole kind of front third would be beneficial in this client. One of the interesting characteristics of this type of hair also, and it's one thing that is quite anxiety provoking in a lot of our clients that have hair like this, is they often try and style it in such a way that they cover up the emptier areas, and they can do it quite well until a gust of wind comes along, or until they have to get their hair wet if they want to go swimming or anything like that. These sort of scenarios can be quite anxiety provoking for people with practically any kind of hair loss, but particularly this frontal hair loss, where styling can cover it quite well. And the kind of release from that anxiety that patients can get once they've had a transplant, where they can just jump into the ocean and not really care about their hair, or they're not worried about a windy day kind of lifting all of their hair up that they've carefully styled to cover up the empty areas, is certainly an advantage that transplants can confer for patients.